Thanks, Charles. Next, we'll hear from Kathy Rocco and Nancy Fellows. They are ASP Senior Clinical Education Consultants, known as CECs. Clinical education plays a key role in bringing our products to market, sharing knowledge with our customers and internal teams, and ultimately raising standards of patient care. Our CECs have always brought a depth of clinical expertise and insight to our customers and ASP. They are all registered nurses with an average of 20 years' experience in the field, and they are also active members and leaders within professional organizations such as AORN and SGNA. Kathy Rocco and Nancy Fellows will now discuss details of the customer experience with the STERRAD system and the SS1E.
Hi, I'm Nancy Fellows. We would all agree that the health and safety of patients and staff is paramount in any healthcare facility. So when selecting an alternative, it is important to not only consider the efficacy of a sterilization system, but also any safety and environmental health risks. And for each system, there are pros and cons. Many facilities I work with are also concerned about the environmental impact associated with the alternative that they select. Any environmentally friendly solution means helping your facility be green, but it also can translate into lower costs, so it's a win-win. For example, the hookups used by the SS1E to supply rinse water and power the UV light consume water and energy, which incur additional costs. The SS1E cycle can consume nearly 9 gallons of water. It uses peracetic acid, a chemical sterilant, to process medical devices. And although the system is connected directly to a plumbing drain, devices may drip water in the OR when they are removed from the unit. Also, peracetic acid often produces an unpleasant odor. The other option, the STERRAD NX system, is a dry system that uses hydrogen peroxide, so there is no exposure to liquid chemicals. The only processed byproducts for the STERRAD NX system are water vapor and oxygen. As a result, no special heat boosters, plumbing, aeration, or ventilation are required. Next, we'd like to discuss the differences between a packaged system like the STERRAD NX versus a wet system like the SS1E. First, let's talk about the STERRAD system. The STERRAD NX system offers terminal sterilization, resulting in packaged process instruments that are dry and ready for immediate use or can be stored for use at a later time. The packaged system also helps prevent potential contamination during transport to the OR. Conversely, the SS1E is a wet system, so process devices are still moist when they are removed. The remaining moisture on the instrument can harbor contaminants after the device has been processed. Damage to endoscopes can be seen primarily due to infiltration of the peracetic acid processing fluid into the rod lenses, which may distort the picture and render endoscopes unusable until repaired, all of which may result in additional repair costs. Another consideration your facility will want to keep in mind when choosing between a wet and packaged system is cycle efficiency. For devices processed in a wet system, if a case is canceled or there's another reason to not use the device, it has to be processed again. Remember, if the instrument is not used immediately, it must be completely reprocessed, and this may mean incurring additional time and processing costs. With terminal sterilization, if the device is not used immediately, it can be used at a later point because it's wrapped. In addition, the STERRAD NX system can help you optimize your instrument flow by processing typical rigid scopes, bridges, sheaths, forceps, and light cords required to perform a routine procedure in one container all at once. The materials and lumen claims of STERRAD systems extend even beyond heat and moisture sensitive devices, allowing you to process most procedure sets together. The cycle time also keeps up with the fast pace of a typical 30-minute room turnaround time. so you don't have to worry about not having your instruments when you need them. With the STERRAD NX, devices can be packaged and processed in as little as 28 minutes to help ensure fast instrument turnaround. There is a standard 28-minute cycle time for most surgical instruments and also an advanced 38-minute cycle time for most single-channel flexible endoscopes. Terminal sterilization does require that staff are trained and versed in proper packaging techniques, which ASP can assist your facility to do. When the instrument comes out of the STERRAD NX system, it's sterile and ready to use right away or at a later date. The instruments will be available when you need them and delivered to the OR in a way that makes your work more efficient.
Hi, I'm Kathy Rocco. One of the most important things that you need to know when sterilizing equipment is whether a particular device falls within the cleared claims for sterility. At ASP, we provide the STERRAD Sterility Guide. The Sterility Guide is designed to provide STERRAD system customers with a list of devices that fall within the cleared sterility claims. It is an easy-to-use online tool that uses a simple 3-step process and is available 24 hours a day, 7 days a week. With a few clicks of the mouse, you can quickly determine if a device can be sterilized in a STERRAD system. ASP, through its Medical Device Manufacturer Program, or MDM program, is continuously working with medical device companies to help them determine if instruments are within the cleared sterility claims for STERRAD systems. Don't forget that there are many more devices that have been able to be processed in the STERRAD system since it was originally introduced. Currently, Karl Storz, Olympus, Gyrus, and Richard Wolf have all released flexible endoscopes that can be processed in the STERRAD NX system. In addition, some major manufacturers have incorporated design changes to allow for easy identification of STERRAD NX system compatible flexible endoscopes. Olympus flexible scopes that can be used in the STERRAD system can be identified by a white stripe on the device control head that indicates its compatibility with the STERRAD system. Karl Storz flexible endoscopes that are STERRAD NX compatible have a silver band near the eyepiece. Most device manufacturers offer upgrade services to upgrade older scopes with new STERRAD system compatible models. Check with your manufacturer for information on upgrading to STERRAD system compatible scopes. We continue to work closely with device manufacturers and are adding to the list of approved devices all the time. For example, we are excited to announce the Gyrus ACMI DUR8 Ultra and many more have been added to the list of devices that fall within STERRAD system claims and have been added to the Sterility Guide. As with all instrument processing devices, the FDA states that devices not validated for processing in the SS1E should not be processed in the SS1E. According to the FDA, the SS1E should not be used on devices that must be sterile unless they cannot be sterilized by other legally marketed, validated sterilization methods. Additionally, as of October 22, 2010, to the best of our knowledge, no IFUs have been released that indicate devices have been validated for processing in the SS1E.